Hey everybody, welcome back to another episode of the Atlanta Dental Spa Podcast. Again, I'm sitting here with Dr. Drew King, and we are going to have a conversation about how Atlanta Dental Spa really facilitates getting people the treatment they need through financials. And we do that through third-party acquisition. And so we really thought long and hard about this because we want to remove all the barriers for someone to get treatment. So we're going to dive in. Dr. King, I think that we've identified in previous podcasts that there's reasons that people delay treatment. And one is, of course, the cost of modern dental treatment, especially high quality modern dental treatment, right? There are lower cost providers that, people can go, and I've seen people go overseas and try to mitigate that. And those sometimes can end not well.
Yep.
That being said, let's just put it as cost is a big concern. Also, the other big concern is it's going to hurt, right? Also, another big concern is kind of like the loss of control of people sitting in a dental chair. Mm-hmm. So I'm trying to just give an overarching thing of like why people don't like going to the dentist or avoid dental treatment. I would say, I've got some statistics here that 40% of people will delay dental treatment because of cost.
Yep.
So,
believe it.
I think cost and fear are probably 80% of that. Mm-hmm. And so we have always looked at Atlanta Dental Spa. We've always looked at from a top-down perspective, right? The name itself is like designed for comfort, right? Everyone likes going to the spa. So our whole thesis has been like, how do we take something that someone is scared of and just get them into the chair, right? And our overarching theme is like, we don't cause any judgment. Like some dentist will go, you'll hear these horror stories where a patient will come in and they'll get judged or scorned or where have you been and what's been going on and why you wait so long? And right, we don't cast any judgment because we know life.
Judgment-free zone.
Judgment-free. And really, and that's kind of like a cliche, but it really is. Like, honestly, I used to just commend people like, look, you made the hardest step.
Yeah, hardest parts to come through the door.
Coming in first one.
Absolutely.
And then us establishing hope. And I haven't met anyone that we haven't been able to give dental hope to.
100%.
Right? And so sometimes people think like, oh, is this the worst you've seen? Is this the worst case you've ever seen? You're like, not even close.
Not even today.
Everyone,
not today.
Everyone's always seen that. So, but let's get to the cost aspect because I think people assume that, I even told my wife this. I said, look, modern dental treatment is expensive. There's a lot of technique. There's a lot of education. There's a lot of expense in running a dental practice. Like dental treatment is high quality dental treatment is expensive, right?
Absolutely.
But it's worth it. And so what have we done to help people? We talked about the fear with Dr. Hamilton, like the sedation and the spa environment and the noise canceling and all the things to mitigate some of that fear.
Yeah.
What have we done to help with people from a finance perspective?
I think we do quite a bit of things, and I'll jump into that. Dental work, high quality dental work is expensive, but it's also more expensive the second time that it's done.
What do you mean? Unpack that a little bit. What do you mean?
So we'll get into a future episode. We're talking about second opinions. But we see a lot of people that will come in and they've had not the best dental experience somewhere else. I think we mentioned overseas, not to throw shade there. There's some good experiences and there's some bad experiences. And I have a lot of people that said, hey, I wish I would have come to you first. And I hate to hear that because I wish we would have seen them before they got themselves in a situation. And now we're fixing someone else's work. And now that is a lot more expensive. So although high quality work is expensive, it's much more expensive doing it twice.
Yeah. And there, and to your point, we're not going to get too clinical in that, but I'm thinking about all the things that can happen irreversibly, meaning excessive tooth reduction. We can't wave a magic wand and get that back. Right?
Can't undo some things.
Yeah. So it's there's permanent problems with sometimes choosing, price as your number one motivator.
Yes. And price for us, to your point, I always want to give someone hope. And I love meeting someone for the first time where we're judgment-free zone. And I want to figure out how we can work with them to get them to do the treatment that they need. So we have a handful of different financing options. And one of my favorite things about our team is just exceptional, and they're exceptional at finding out where a patient is financially and figuring out a way if we can meet them and go over things that they need and treatment things that are required to get them in a better situation. We have a team working tirelessly and through all our different financing options. We can, without getting too granular, the cherries, the care credits, the outside financing companies, We also have a membership program that can give a lot of people benefits just on being a part of our club. But biggest thing for us is we really try to figure out a way that works for them without, putting too much stress on their life. Yes, you need to fix your mouth, but the rest of your life also matters at the same time. So our team is just incredible at working with people and figuring out a way to make it happen.
Yeah, finding out where it works, right?
Yep.
And I think we live in a, for example, I think we live in a monthly economy. And so,
Sure.
Sometimes when you've delayed treatment or that you have a lot of dental work to do, you get a big, holy cow, this is a big treatment plan. Yep. And then you see all you do is scroll down to the bottom
line. Yeah, first thing.
Like, whoa, that's a lot. But I think if you can break it down, like your cable company doesn't come to you and say, hey, here are 10 years of service we're going to give you. And, for the price of it's going to be $10,000 for 10 years. You'd be like, what? I'm not doing that.
I don't want cable.
They're like, but wait, what about $300 a month? They're like, I can do that. I'll do that. So I think breaking it down for people where it can work into their lifestyle. And I've seen almost no situations where we can't find a way to either extend stuff or get them in. But I'd rather see people have the conversations, right? And financing can be done for as little as you said, $500. You've seen it done, right? Absolutely. So there's no too small amount, and honestly, there's really no large amount. I mean, some very robust treatment plans go into the $60,000-$70,000 range, and even then there can be financing. It's different companies, so that's why you're saying you have the gamut of companies to make sure that people are covered.
Yeah, and sometimes honestly, we use multiple companies to figure that out.
Really?
Our treatment coordinators, we've been around a long time. We've seen a lot of things, and we've made a lot of things work for people. Or to your point of, the dentist is already scary. It's already an uncomfortable place. Right. Hey, here's your $60,000 treatment plan.
Right? How are you going to pay for it?
How are you going to pay?
And I'm not.
And I pride ourselves on. Excuse me. When that treatment plan is delivered, it's hey, how can we figure out a way to make this work for you? And how can we better your oral health and financially get you in a good position that we can figure this out for you?
Right. Yeah. And typically it can be worked into, like you said, a monthly plan for someone. So it's not burdensome. Yeah. And I think the key is like, what you don't want people to think is that they have to aggregate all these funds in order to get the care. For sure. And because what can happen, as we've seen, is I think you alluded to a little earlier, is that if you wait 5, 6, 7 years, the problem that was probably a level 3 problem could now be a level 7, 8, 9 problem, which could be more expensive. So that the waiting could actually track the expense.
The time is working against you.
It's working against you, right? So if you want to come in and you need a little care, like come in now and let the burden of how it's going to work financially and otherwise fall on Atlanta Dental Spa. For sure. Honestly.
And I've even had people, that are apprehensive, and we have that conversation. They say, "Hey, I'm so glad I came in to talk.
Right.
Give me 6 months, and outside financing, or they get something else. We work with them, and they're back and they're ready to do treatment because now they know."
It's look, I think that you mentioned the word hope, and I think that's so pivotal in today's dentistry because a lot of people feel hopeless about their dental state. They feel maybe hopeless that I can't afford it. Hope, all these things. And it's just finding solutions so that we can come to the aid and really let them be the hero of their oral story. I always say we're just the guide trying to guide people to dental success or getting them over things. We're not the hero of the story. The patient's the hero. And, and our job is just to help facilitate. So it's really cool. And you mentioned, right, the treatment coordinator. A treatment coordinator's job is not just to say, hey, here's your plan, here's your treatment. I'm coordinating your treatment. It's actually to coordinate how it all works. For you, right? I mean, financing, comfort. Do you have apprehensions? It's your liaison between the doctor and patient, right? Yeah. She sits in the middle.
And I always leave it with this is your treatment liaison. I love that word. And I've had treatment coordinators go back and forth 100 emails with people of how can we make this work? How can we figure this out? Apprehension. Hey, night before, I'm so nervous. Hey, you're in great hands. This is what we're going to do. So that team is absolutely incredible, and we have the best treatment coordinating team in the world. I would tell you that.
Yeah. So there's really nothing else other than we have the means because what would you say? What percentage of people would you say? Let's say it's for more comprehensive care. What percentage would you say are we helping? Like of the population of like our patients, how many people are getting financing versus not?
I would say for your bigger cases, I think well over 50% are financing.
Yeah, that's what I would guess.
And it's funny. Some people come in and say, "Oh, how do people pay for this?" And the answer is, we find a way. We finance. That's what we do. And they're always, "Oh, I'm not the only one." It's like, no, that's a big portion of who we help and who we see because
Yeah, 100%.
Yep.
I would be, yes. Okay, so I like this. I like the where we stand on this. Everyone knows. Does the if I was a patient,
Yep.
and I wanted to make sure, I didn't want to go in and apply.
Yeah.
The link is on our website, right? Where
The
you
link
can
is on
do
our
this
website.
all from the comfort of your home, and you can find out where you stand.
You can. We have a financing page with all the companies we work with. Some of them you can. I love when someone comes in for a consult and they've already applied for a care credit or a cherry or something like that. But you can see your credit limit. You can see what you're looking for. Now you wouldn't have the amount of treatment, but you can have an idea of, hey, this is what I can work with within my budget.
Yeah, and then therefore the scope of what can be applied,
Absolutely.
right?
Absolutely.
And so I think that's good. I think people have anxiety. I know I would about going into an office and having to fill out a credit app like on the fly, like who's watching me kind of thing. So I think doing it from the comfort of your home is a really cool thing that we offer just from doing it a link.
Go to the website, check it out, and get all the information there.
Yeah. So don't let finances be a barrier to let us, augmenting your life through amazing dental care. Let us figure out how to do that. And good one, Drew.
Awesome, man.
All right.